Hello everyone, good day. We are still waiting for more participants to join us. So yeah, we get ready in few minutes. Hello, hi everyone, good day. Thank you so much for joining us today. You can turn on your video so that we can see you. So on behalf of the Asia Pacific Evaluation Society, APIA, and also Evaluate Asia chapter, I would like to warmly welcome our speaker today, Mr. Mohib, organization leaders and participants to our 16th capacity building training for young and emerging evaluators in conjunction with the Youth Evaluation Forum 2026 with the title of Economic Evaluation Methods and Principles. So we are very delighted to have everyone from across the region, including different countries and organizations to join us today. So thank you so much for taking the time to participate in this learning session. So we are proud also to share with everyone that APIA has been recognized as a Youth in Evaluation Legacy Champion for 2026 under the Global Eval for Action campaign led by Evaluate and Partners. So this recognition reflects APIA's long-standing commitment to empowering young and emerging evaluators across the Asia-Pacific region through leadership, inclusion, collaboration, and meaningful participation in evaluation. So can I have like reaction from all of you so that we can know that there are someone behind the screen? So you can put thumbs up or you can put in the comment in the chat. Any reaction? Well, I guess we are still at warming up, right? Okay, so worry not. Um, So let's continue. So the topic for the webinar today is economic evaluation methods and principles, which aims to strengthen our understanding of economic evaluation approach, methods and practical application within the development and evaluation fields. So we are very honored to conduct the session today with the collaboration with all organizations as present on the screen. So this is a collaborative learning session brought together with support from all organizations. And we are very excited to have you all here joining us from different countries. And we hope this session will be both insightful and practical for your work. And so my name is Hakimah Muhammad. So I'm one of the co-leader of Evaluate Asia and also Evaluate Malaysia. And I will guide you through today's program and support the flow of the session from the start to finish. And before we proceed, I would like to share a few ground rules for everyone to ensure a smooth and engaging session for today. So first, please update your Zoom display name using this format. As you can see my name, Hakimah Muhammad, in a bracket, she and her. And then you can put your first name, last name, followed by your gender pronouns. And we hope that you kindly keep your microphones muted throughout the session unless you are speaking. And we encourage you to keep your camera on if possible, but please feel free to turn it off if needed for connectivity reasons. You are welcome to drop your questions in the chat box at any time. We will collect and answer them for the Q&A session at the end of the workshop today. And if you experience any technical issue, please let our team to know in the chat, right? Right. So by the end of this session, we hope that all the participants will achieve to understand the purpose of economic evaluation for decision making, gain an overview of key methods such as cost effectiveness analysis, cost benefit analysis, and social return on investment, or SROI. We also hope that the participant can learn the core concepts such as opportunity cost, efficiency, and value for the money. And finally, understand how to interpret and apply findings in your policies and programs in your own organizations. So without further delay, before we invite the speaker, I would like to invite our opening remarks speaker, Mr. Kasun, to share the speech. Mr. Kasun is the co-leader of Eval Youth Asia, co-leader of Eval Youth Sri Lanka, and Youth Engage Evaluators representative to the Sri Lanka Evaluation Association Executive. The floor is yours, Mr. Kasun.
Thank you, Hakima. Am I audible? Hakima?
Yes, go ahead.
Yes, Kasun.
Okay, thank you. Good morning, good afternoon, and good evening to everyone joined from around the globe. It is a great pleasure and honor to give these opening remarks of today's webinar called Economic Evaluation Frameworks and Methods. Firstly, I would like to extend my sincere appreciation for Asia Pacific Evaluation Association, and again, many congratulations for your great achievement to organize this important learning platform and continuously creating opportunities for young and emerging evaluators across the region and as well as across the globe. Economic evaluation is becoming increasingly important in today's development context. Whatever we work in, maybe it's health, education, climate action, social protection, or any community development. Decision makers are increasingly asking a very important question. How can we achieve greater impact with limited resources? We need to answer this one. This is why understanding economic evaluation frameworks and methods is essential for evaluators. It helps us not only access effectiveness, but also greater evidence on efficiency, value for money, sustainability, and also decision making. As a YES, like these sessions are really important and valuable because we can strengthen our technical capacities and also encourage us to think critically about the evaluation can contribute to better practice, strong programs, and more accountable development practices in the globe. I'm quite sure and confident enough today's discussion will provide practical insight, meaningful learnings, and inspiring for all participants. I also encourage everyone to actively engage, ask questions, and share your perspective thoughts in this session. Thank you once again, Apia, and all speakers, organizers, and all participants for being part of this important conversation. I wish you all a productive and insightful webinar. Thank you. Over to you, Hakima.
Yeah, thank you so much, Mr. Kasun, for very inspiring opening remarks. Yes, I do agree that it's not only we need the evaluation skills, the tools, right? But we also need to look beyond, like what's more. How can we do a very good project? How can we measure the impact of the program, right? So that's why we are here today. And now it's my pleasure to introduce our speaker, Mr. Mohib Iqbal, Principal Evaluation Specialist at Insights Lab International and Vice President of the Asia Pacific Evaluation Association, APIA. He brings extensive experience in evaluation, research, and evidence-based policy making across the Asia-Pacific region. So I'm very honored to have him with us today to share his expertise on economic evaluation methods and principles. And I want to quote again what Mr. Kasun mentioned just now. Please, everyone, to really focus on the session. If you have a question, please put it in the chat, and then we're glad to actually look into your questions later. And without further ado, Mr. Mohib, the floor is yours.
Thank Hakima and Kasun. Thank you for the great introduction to the session. And I will share my screen. And while I do that, I will remove a few sort of things that will appear here. And then we can get started. Um, Thank you, everyone, and welcome to this masterclass on economic evaluation frameworks and methods. My name is Hakima and Kasun. Thanks for their kind introduction. My name is Mohib Iqbal. I am Vice President Asia Pacific Evaluation Association, APIA, and I'm also a Principal Evaluation Specialist at Insights Lab International. We are going to discuss economic evaluation in details. What to expect from today's session is that we will have a sort of an opening introduction to the economic evaluation. Then we will go through a 10-step process that how you conduct an economic evaluation. And at the end, we will show you how we bring economic evaluation into decision making and what its results could actually look like. Um, I'm happy for all of you to ask your question as we go in the chat, and then we can, at the end, we will have plenty of time to discuss. I'm very grateful to see a very strong interest in this webinar. I can see quite a strong number of people have appeared here. I think the objective were covered by Hakima, so I'm not going to go to a lot of details. As I said earlier, we will discuss the purpose of economic evaluation for decision making, and especially when from an evaluative perspective. We will have a chance to discuss three of the very key methods in economic evaluation: cost effectiveness analysis, cost benefit analysis, and social return on investment. While economic methods are a broad sort of spectrum of methods, we focus on these three methods because they are the most used and the most relevant to evaluation. Economic evaluation has a very large variety of key core concepts and principles. We will cover some of the highly relevant of these. As I said earlier, we will get to talk about interpreting and applying finding in policy and programs. It is important to note that this is going to be a brief session, 90-minute session where we'll discuss this. We do a 1 day and a 4 day version of these trainings as well. The 1 day one was delivered as part of the fifth APIA conference in November 2025 in Tokyo. And in a number of other places, this has been delivered in University of New South Wales, in a number of other workplaces, and when sort of clients sort of request, we based on request, we also deliver this and other training on evaluation. Before I jump into and start talking about economic evaluation, I wanted to bring all the participants on the journey with us, and sort of to have a little bit of a discussion on how economic evaluation or where economic evaluation is appropriate and what kind of decision it can inform. Usually in the longer session, in a day-long session or 4 day sessions, we take enough time to introduce all the basics. For example, what is evaluation? Why do we do evaluation? And what kind of decision it can inform? And some of the basics, for example, what is a program logic or a log frame? What is a theory of change? And how do we sort of define certain things in the evaluation progress? I'm assuming people who are here today are quite familiar with those things. So to start with an example, Simone 2011, she conducted a economic evaluation of reading programs in primary schools. She considered four programs, and As part of these four programs, there was the Accelerated Reader program. This program involved a software that teaches kids how to learn how to read, and then teacher conferences for teachers to learn how to teach reading literacy. So that's one program. The effect size for this program was, after a rigorous evaluation, was 1.61 standard deviation improvement from the baseline. Then we have class-wide peer tutoring. In this, student peers were allocated to reading and teachers sort of guiding them and how this improved reading. So that's really the question for the evaluation. And the effect size for this one was 292 standard deviation in addition to the baseline. So there was an improvement, a positive effect of the program. Then we have reading recovery. It's one-to-one tutoring with specially trained teachers. So these trained teachers are trained to teach reading literacy in primary schools. And this is one-on-one. So it's a very intensive program. Every student that is falling behind gets a teacher to work with them to improve their reading skills. And this program produced very large effect, almost one standard deviation higher than the baseline, so 0.937. And then the last program is Success for All, which produced homogeneous groups, similar groups. They group students in a way where reading capability among students was the same in the group. They also added one-to-one tutoring for and specially trained teachers for lowest achievers. For students that were struggling the most, they got this additional support as well. This program also produced positive impact of 0.256. So one of the questions that we have and we want to bring you on this is, how would you which program out of this would you select based on the effect size that you can see? So I am sharing a question. I want you to select one of these programs. I will leave, I think you can see my screen, and in your screens, you would be able to see this as well. So I think you only have to select one program and the results will start to appear. So I will give you 1 minute for everyone to think about this, and I will leave my screen sharing for you to look at the programs and select one program that you will pick based on the effectiveness. Which program, if you were the decision maker and an evaluator came to you and said, here is the four programs that you have. Out of these are the effect sizes. Which program would you select? So please select as as you go, and then in a minute I will share the results and then we can continue our conversation. Please, yes, thank you. People who are writing in the chat, thank you. That's also very good. But you can also sort of vote on the uh, poll that we have put. In a second, I will share the results. Maybe I'll share the results right now. And then what we can do is I can still see, I'm not sure if the participant, can you see the poll?
I think you will have to relaunch the poll.
Yeah, we
Okay.
couldn't vote actually just now.
No
Yeah.
one could vote actually. You will have to relaunch the poll.
Okay, I will relaunch the poll and see what happens. Poll. Can you see it now?
Yeah, we couldn't because there is like a black image, but we couldn't see the content of it. Yeah.
Can you see it now? Maybe I might stop sharing my screen,
Yes, yes.
and
I
that
will
way,
try to launch.
and maybe that's how you could see the poll. Can you see the poll now? Yes, I can see some people are polling now. No, it
Yes,
can't.
yes, we can see
we
the
can
poll
see.
now. Yeah.
Yes. We'll give it 30 more seconds, maybe. So the question really is based on the effect size, which reading program would you select? And I can see the reading recovery is getting around 71%, two-thirds or more than two-thirds of the polling. And that's the right answer in the sense that we would want to select the program with the highest effectiveness. And that's, I think, what we can see here. So I will go back to my presentation. I will end the poll here. I think 55 people have voted. So that's, I think, a very large number. So you can see reading recovery stands out as the program that most people selected. And I think that is, as I said earlier, that's the right answer here. Now, when the effectiveness evaluation was undertaken, they also brought in, I'll stop sharing this. They brought an economic evaluation person and they said, okay, we have 4 programs. We know that reading recovery is among the best program, delivers very good results, followed by class-wide peer tutoring and followed by Success for All. Accelerated Reader as the program that delivers the least effects in this case. Can you tell us which of these programs is the most cost-effective program? And that's where the second slide that we will go to comes. Now we can see the ratio calculated as effect size per $1,000 spent. So when you weight the effect size by the amount of dollars spent, you can see quite a huge change in the effect sizes. I will launch another poll. So given last time it didn't work, I might stop this again, save this, and then put this on my screen. And stop this one and go to poll. Okay.
We launched Mohit.
Sorry. Stop sharing.
We launched the question number 2.
Please, can you do that, Ahmed? That will be good. Thank you. Yes. So after we have the economic evaluation, which program would you select? Given you can see the poll, what I will do is I will still show you the slides so you can select the right program. I'm sure you can all see the poll. So I'm still going to keep showing my slides as well so that you can see. I can see around 90% of the people have selected the class-wide peer tutoring, and that's the right answer in the sense that we can see that the effect size per $1,000 spent is the largest for class-wide peer tutoring. Now, I will end the poll. I think we have pretty much all the people that have now sort of polled. What does this example tell us? It's really the purpose of economic evaluation is to go one step beyond the impact. Not every effective program is cost effective. It's, we do evaluation. Usually evaluations are focused on outcomes and impact. And we do a rigorous evaluation. We see that a particular program turns out to be the largest effect, but does it produce the most cost-effective outcome for the people, for the government, for the citizens? And we can see that economic evaluation can shift decision-making very clearly into a different program. So this is really the purpose of economic evaluation, where we can see that based on the economic evaluation, the decision change. So what this means is the economic evaluation is the approach that tells us whether a policy is appropriate use of resources compared to an alternative. So there's a few things in here when I say that. There is a single program that we are looking at. Number two, we have effectiveness results. We can see across these four options. And there is alternative programs. So we are comparing the program to something. In most cases, we are comparing the program into the baseline or what we call the business as usual scenario. But in this case, we have four programs to compare across. So this is exactly where we are going to discuss how we get to these kind of decision making. So what is economic evaluation? I think you saw it in action. Economic evaluation is about resource use, where our dollars or our currency or our financial resources are best used. And the economic sort of resources that we are using, is it the best? Are they used in the most efficient way? To get to resource use, to get to the economic evaluation questions, we need to know, before we get to that, we need to know what is good. This is the fundamental question of evaluation. Evaluations are undertaken to define success and then measure success. For example, in those reading programs, we saw the effect sizes of different programs. So it follows an impact or an outcome evaluation. Economic evaluation used to be very technical, very analyst driven, and that has been one of the weaknesses for a very long time. Recent methodological development has made economic evaluation very participatory. In particular, recent methods by Julian King and many others have brought in rubrics. They have brought in, say, stakeholder engagement, development of criteria by stakeholders, development of standard or the quality of impact by the participants and by the program participants, by the program managers, by the donors, by all those people who are involved in decision making. So economic evaluation, while very technical and sometimes very analyst driven, is also becoming more and more participatory. We are able to bring in the voices of stakeholders, various stakeholders, program implementers, program managers, donors, or in some cases, in many cases, Ministry of Finance, who is funding the program, or parliaments who are approving these fundings, become relevant in economic evaluation decision making. Why do we do economic evaluation? I think we saw this in action in the example. Mislik et al. 2015 says that cost analysis is everywhere. It exists across decision-making spectrum, from planning, from designing, from planning, from implementing, and when we are doing evaluation. Across all of this, decision makers are thinking about money. They're thinking about cost. They're thinking about finances. And this is more apparent in the recent time. For example, particularly as international development aid become more and more scarce. We know, for example, the United States cut a huge amount of their budget by abolishing the US aid. And now that has made even the little finances that were in the international development sphere even more scarce. In places where governments are funding programs, governments are under increasing pressure to justify to the parliaments, to their people, and to decision makers that the money they're spending on programs are worth the programs, are delivering impact, are the most efficient way, the most cost-effective way of delivering programs. Now, once we know some of these basics, some of the foundational issues that economic evaluation follows the sequence after an outcome or an impact evaluation, that we know economic evaluations are about resource use, that we know there could be participatory, that we know whether we like it or not, economic evaluation exists in one or another form. For example, when budgets are approved, people think about which program to fund. Budgets are not unlimitedly available for everything or every idea that exists in the bureaucracy or in the government planning or the government decision making. Now, how do we conduct economic evaluation? There is many ways to explain this. There is many ways to put this together. One of the best ways that I like is by Broadman et al. This is a 2018 book on cost-benefit analysis, but it goes beyond that and talks about economic evaluation in details. This method has been adopted by a number of other institutions, for example, the Australian government, many other government in Canada, in the United States, in other places. This has also been discussed by Levin et al., who also does a lot of work in economic evaluation in the education program. So they propose a 10-step process. There is 2 phases and 10 steps. In the first phase, we really set up the economic evaluation. We set up the framework. We set up the way we will do, and we set up the parameters and different things that are important for economic evaluation. In the second step, we actually get into the action and we start doing the cost analysis. Then we measure the benefits if we need to. We choose an economic evaluation method. We talk about adjustment to these costs. For example, not all financial costs are not the only amount of money. For example, there might be resource use in the economic evaluation in the program that are not captured by financial expenditure data. Once we get to sort of do all of that, then we do some sensitivity analysis, and finally, the final step is reporting. We will discuss these 10 steps in a little bit, it will be a little bit of a quick process because usually, as I said earlier, this process takes up to a day to explain step by step and bring examples and show how each part is implemented. But today we are going to sort of go through it in a little bit faster way. So in terms of objective and purpose, when we are thinking about economic evaluation, they could be the purpose is defined by the program or the policy that we are sort of evaluating. But this could be prospective before the program starts. And this is where economic evaluation or economists or evaluators come and will undertake before the program analysis to show the program planning process that the program will be an effective program. The money spent on this program will be the best use of the money or the resources that we will be using. Money, human resources, classrooms or hospitals or anything that we are using. In this type of evaluation, a lot of the ingredients of or the parameters or the elements that comes to the planning, the cost side is the budget that we have allocated and all the other resources that might be needed for the program. For example, if the budget of the program is $100,000 or $50,000, that's the financial cost. We also look at other elements where people working in this that have been paid already by government through other sort of projects. So we bring those costs. If there is venues and equipments and things used, we then bring the cost of those things into it. If there is volunteers working in the program, we need to measure their cost and we need to bring that into it. So those are all going to be estimations, The benefits of the program in that sense are also forecasted. We assume that the program will have a particular amount of impact. It will improve, for example, student learning by a year, or it will improve particular disease. For example, if we are talking about immunization rate, polio immunization rate, or if we are talking about, for example, COVID immunization rate, or if we are talking about influenza immunization, or if we are talking about antenatal care or postnatal care, all those maternal mortality, child mortality, all those indicators, we will put a dollar value on them, and that will be an assumption. They will be forecasted that the program will have this impact. This is a very powerful method to tell you from a budgeting perspective, from a resource commitment perspective, from a planning perspective, whether the program is worth undertaking and worth investing in. A second type of economic evaluation could be implemented during the program. This is especially relevant for large infrastructure projects. Large infrastructure projects are usually over many, many years and sometimes over a decade or two. And during the program, many other questions come up. For example, from our experience, infrastructure program, building a highway or building a dam or building a housing project or building anything that costs a large project or many years, there is a lot of uncertainty. There is significant uncertainty. For example, one of those uncertainties, we can see it in the recent times. COVID-19 was a huge uncertainty for business planners and for budget planners. And when it came, it increased the cost of many, many programs because programmers needed to bring health and safety into every program, and those budgets were all affected. So in that case, you come in and you do an economic evaluation. This type of evaluation will have all the cost that has already been accrued, that the expenditure that has been made, and the planned expenditure that will be made in the program in the rest of the program's lifetime as we implement it. And then the benefits of the program, whichever benefits have already accrued, if it's a highway, for example, if 50% of the highway is built and is already being used by people, we can start to sort of bring those benefits in. If it's a housing project and half of the houses have been built and sold, or it's a social housing, people have already sort of rented them or something, we will bring those benefits into it. And then usually these kind of economic evaluation tell planners whether the planning that they had initially is still relevant, what has changed, and what will be their effect on the budget, on the costs, on the benefits of the program. And this usually could lead to program planners to take their budget back to parliament or to government and say, now this program will not cost us 100 million. It could potentially cost us 150 million, 200 million. And this happens quite regularly. If you look at any infrastructure project, if you look at many infrastructure projects, they usually face the program of being underestimated at the beginning and then being, needing to have more budget or some sort of changes. So another question this type of evaluation could answer is that if we have to change this program, what are the elements we have to change? What are the least effective elements? What are the most expensive elements? And these kind of insights are usually produced by the medias res economic evaluation or the program evaluation that we undertake as the program is being implemented, or as the program is underway in some sense. The most and then we have the retrospective economic evaluation. This is the most used economic evaluation method. And it's in a sense the best because it tells you once the program ends, once we undertake an impact evaluation or an outcome evaluation, this is where this happens. This could also be, for example, a program might have multi-stages and in one stage ends and we do an impact evaluation, an outcome evaluation. We see if the program was effective, if the program was beneficial to whom and how. Once all those questions are answered, then we can do an economic evaluation and see whether the program is also cost effective compared to some other alternative program, as we showed in the reading program example. This type of evaluation is very, very useful for business planners, for budget planners, for program planners to know if this program will be funded again, if this program will be scaled. For example, if a pilot project is implemented in hospitals to see, for example, what improves waiting time in emergency room, or what makes it people to sort of, have a better experience in the emergency room. These type of programs could actually give us quite significant hints into which way of changing the program will help us achieve the best result in terms of thinking about money and cost and budget. As I said earlier, this is the most used method in economic evaluation. Most of the economic evaluation that I undertake are either prospective or retrospective, but most of them are retrospective. At the end of the program, at the end of a pilot study that we are trying to pilot a small program and then we try to scale it, this can also inform scaling up programs to, for example, a program is implemented in one city and now the government wants to implement it across all the country or many other cities or many other rural areas. This evaluation will tell us how much the program cost will be at a scale, whether the program unit cost, for example, the admission of one patient to a hospital would increase or decrease if we were to scale the program. So those are the type of question retrospective economic evaluation could answer. The second very important thing in economic evaluation is whose costs and benefit counts. That's a very important important question in economic evaluation, because economic evaluation could be at a very small scale. You are looking at a very small unit of analysis, for example, a school, a hospital, a municipality, a city, any of those kind of things. Or it could be sectoral. It could be Ministry of Education as a whole, Ministry of Health as a whole, Ministry of Urban or Rural Development as a whole, or Ministry of Justice as a whole, any other sort of, unit of sector as a whole. And then we have the largest sort of perspective in which we take societal perspective. For example, a program at a country level, or even a program at the global level. For example, the global response to COVID-19 is a program that was implemented across the world, for example, vaccine distribution, whether that was effective or not, whether that was cost effective or not. In the first type of evaluation, where we take an individual perspective, we calculate the program in a way that cost and benefits of only a single unit of analysis are included. For example, if a school implements a program that is teaching reading, trying to improve reading or mathematics among students, and this program is implemented nowhere else, we will look at only that school and we will look at the cost and benefit to that school. For example, that will include training teachers to be able to teach better about reading. For example, establishing professional development for teachers and school leaders to be able to do that program better. All of those costs will be included. The benefit of this program will be to students who are in the school and teachers who are in that school. That's it. However, imagine if a teacher leaves after getting all this training into another school. Do we count that those effects that the program now is having an impact in another school? Or if a school leader was trained and that goes to another school, or if a child was trained in reading in a way and that goes to another school and have an impact, positive impact in other peers, would that be included? No. In that kind of perspective, we do not include any effect that are outside that single unit of analysis. In the second perspective, as I said, this is, for example, Ministry of Education or Ministry of Health is implementing a program. It is considering all the benefit and outcomes incurred across the entire health system, for example, or across the urban development sector, or across the justice system, or across any other system that we can think about. For example, if a municipality decides to improve roads in a municipality, now this road will have better impact on the businesses in that area. It will have better experiences for the citizens of that municipality. It will have better experience for the cars that are in there, and all of those impacts will be included in the program. Now, the same program will also reduce emissions, for example. That's one example. That is the carbon dioxide produced by cars in that roads, because those roads have now improved. The journey time through these roads might have decreased. So the saving in terms of maintenance cost of those cars and the petrol and all the others will be included in the model. But because the environment has improved, that is not going to stay in that municipality. That will have a broader impact in the country, for example, or in the province or in the city. Sort of the whole city might benefit from that program. And the reduction in those emissions might not be included, given the program has only sectoral perspective. So it's really the inclusion and exclusion of cost in this type of perspective. In the societal perspective, as I said earlier, this is the largest and broadest view of anything. If a country implements a program, for example, it improves its health system, and that health system produces benefits for its citizen, but all the people who travel to that country and get treated, even at a cost, will be a benefit to another country. For example, medical tourism is a very common thing. Would those benefits be included? They will not be included because we are only looking at a country. But if we were looking at a regional level, for example, if India has a better health system and people from Bangladesh, Nepal, Afghanistan, other countries come there and get treated for particular disease, the cost of those people will not be included. The benefits to those people will not be included. But if we were looking at the South Asia region, then we will include all of that. If we were looking at a global level, then some people from the US, from Indonesia, from another country, from Nepal, from Maldives might travel there and get treated for particular diseases. And those benefits and the cost that is incurred by the Indian health system will all be included because we have a global perspective. Immunization is the best example in this case. When we immunize one country against a particular disease, it has a broader global impact. For example, in the era of COVID-19, when countries achieved sort of herd immunity, what was called at the time, or which was 50-60% of the people being vaccinated against COVID-19, what that enabled that country is to, for example, open up its borders, allow travel, its citizens were able to travel, and all those benefits started to flow for other people as well, for the global economy as well. And if we are doing a cost-benefit analysis or a cost-effectiveness analysis or social return on investment analysis, we will include all of those benefits in that economic evaluation method. This is a little bit abstract when we are talking about it. I hope the examples that I'm providing are giving you at least an idea of how these various perspectives could differ. One program could be very, very cost effective when you consider global and social perspective, but it might not be very effective if you look at the individual hospital or individual sector. And that is where perspective matters quite a lot. If our budgeting, if our investment in program, if our investment in our social welfare and social sort of betterment are targeted at the citizen of a country, and those are included in the models, it will produce one benefit. But if they include sort of tourists and other people who come and benefit from that, this will produce a very different, because we are increasing the size of the benefits while the cost to those people might be very small, because usually having a good health system or having another good environment or having a good education system might have quite substantial cost for a country, and those costs are usually paid by the citizen of those countries. And that's where I think this perspective matters quite a lot. Now, once this is, as I said earlier, we are slowly establishing the framework for an economic evaluation with any type of economic evaluation. So we will think about the purpose, objective, what is our purpose? Then we will look at whose benefits and cost counts. And then we need to establish the program itself. What is the program? And what alternative we are comparing it to. The alternative program that we are comparing this program to is also very important, because as you saw in the example of the reading programs, we had 4 different programs, and the government could have decided to go with any of these programs because they were all effective. They all produced positive effect. The government could have decided to go with the most effective program in terms of impact and in terms of outcome. But when they did an economic evaluation, they get to know that extra bit, that which program was most cost effective. So it will cost you less money to get the program to more children and improve children in reading while spending less money. And I think which government doesn't want that? Every government, every finance minister employee will tell you, we want to spend less money. So the program, as I said, would be that, and the alternative. In many cases, alternatives could be, as I said, business as usual, doing not having the program. So how we do that is before we start an economic evaluation, before we start an impact evaluation, we really need to know the status quo. Right now, if we are starting this program today, what are we doing? For example, if we are talking about reading program, the school might already have some ways of trying to improve reading. They might not be the best, they might not be most effective, but they are doing something. They're not doing nothing. It could be nothing in certain things, but in our example, there is something that is happening. As the slide, you can see status quo is not doing nothing. Sometimes it could be doing nothing. For example, building a highway or not building a highway is doing nothing in a sense. It could be a school doing something to try to improve reading for children or mathematics for children. It could be a hospital trying to improve people's and participants and patient experience in the emergency room. But whatever they're doing, that needs to be counted. Its cost needs to be counted, its benefit needs to be counted, and then it needs to be compared. In evaluation, we usually do baseline surveys to capture what is happening, to capture all the activities and to capture its impact. What is its impact? And then at the end line, we do an end-line survey and compare our effects to the baseline. And that's where we understand if the program that we are implementing will initially will produce better outcome than the status quo, will produce better impacts than the status quo. And in terms of the economic evaluation thinking, will produce more cost-effective outcomes. So it's important that we know the program A, whether it's a reading program, whether it's a emergency room experience improvement program, whether it's building roads to improve the experience of municipal sort of people living in a particular municipality, or improving business environment or something like that. So that's the program. And the alternative could be doing this in 2 or 3 ways. For example, building a highway compared to widening an already existing highway. If you have an highway that already exists, adding 1 or 2 lines to that might be easier than building a whole new highway. For example, it might cross through mountains, through rivers, through all sorts of things, and you will need to build quite a lot of infrastructure to put this new highway in. While widening the highway might not have all of those problems. So those are the kind of alternatives we are looking for to compare the program and its impact. Whether this is a prospective or in the middle of the program or retrospective economic evaluation, always we need a program and an alternative option to compare between the two. The next thing is we need evidence of effectiveness. If we do not have the evidence of effectiveness, it's very difficult to undertake economic evaluation, because any type of economic evaluation is dependent on whether the program actually works. If the program is not working, if the program is having sort of struggling or some sort of, facing some sort of problems, then it will not be a very wise thing to go on and do an economic evaluation on that. When we think about, what are the benefits of the program, we think about impact and outcomes. Who benefits from the program? I think this is where we think about participant. Who are the participants of the program? As I said earlier, in the case of a highway, we might be thinking about the citizens of the country, but also tourists. In this case of a good health system, we might be thinking of the citizens of the country, but also those people who come through health tourism. In the case of good education system, we might be thinking about people who are from the country and international students who are coming to join those schools and benefit from the better education system. And then we think about the extent, the scale of the benefit to the participants of the program. This could be the benefit to drivers on those highways, the benefit to students in those better education system, and the benefits of the patient that will benefit from a good health system or a better experience in emergency room. Usually impacts and outcomes are incremental. As I said earlier, we have a baseline, where we have a highway, and for example, 10,000 cars are driving through it a month. When we are widening this one, maybe 20,000 will travel. Or if we are building a whole new highway, it might reduce the time travel for people. And those are the kind of incremental benefits that we will bring. If we reduce driving time between two cities by an hour. If this is a 5-hour drive and we reduce it by a new highway to 4 hours, there could be a lot of benefits to that. And that's where we're only reducing the benefit by an hour. So it's incremental. It's not like we are bringing something entirely new. Usually with programs, that is the case. Time horizon is another very, very important thing. And this is, again, as I said, step by step, we're establishing the framework for economic evaluation. And this is another very critical element of that. A project life over which the program produces benefit is the time horizon for that program. This needs to be considered in the impact evaluation, in the outcome evaluation, and this also needs to be calculated in the economic evaluation. For a project such as a highway, it could be up to 20, 30 years. For an education program that improves student grades and student learning, it could last up to 40, 45 years of their working life. For a immunization program, for example, flu immunization, it could be one season over the winter, just 3 to 4 months, and maybe beyond that a little bit. So what is important in this is that we need to set the time horizon with stakeholders, do some literature review, and clearly understand at what time the program benefit stops to be the program benefit, or there are other things that then starts to sort of produce those benefits, or other programs will come in and all that. So that needs to be taken into account. It could be short term, medium term, long term. There is a very relevant things into this. They call it the outcome fade out. By what time the impact of the program reduces. For example, if we train a teacher to teach a particular way of literacy in this classroom, they will get a training, they will go to the classes. Over the next 2 to 3 years, they might default to the method that they have learned in the university or they have practiced over many, many years. And that's where the impact of the program finishes. If you do a refresher, you then bring back the program effect. So that's another way to look at program outcomes. We need it to be long enough to capture all the benefits relevant to the program, not benefit that are coming from other things. For example, in the case of immunization, if we take the whole year, it's because the weather changes and the season changes. The flu season is actually not as harsh as in winter as it is in summers. So we might be calculating the natural benefits from the weather or from the climate into the program. So it needs to be relevant benefits only. We can't be too long because we can then bring a lot of uncertainty into it. And sometimes calculating future benefits requires forecasting. We need to have sufficient long-term benefits to include in the model. And for that, there's particular methods, economic methods and statistical methods that we forecast, what is the impact on target groups, for example, what is GDP growth rate, or what is the, what if you educate children, how much that benefits the labor sort of market and how much that improves their wages over time. And we also need to be aware of externalities. So externalities could be negative or positive, and it needs to be discussed with the stakeholders and included in the model. So time horizon is really about the length of the benefits that the program and the alternative program that we are comparing will produce. For example, in our reading example, maybe one of those programs produced really good short-term benefits, but in the long run, it didn't have really positive impact. So those needs to be really taken into account. I'm also watching my time to be able to finish on time. Those 5 things that we talked about are really setting up an economic evaluation. Once we have all of those things, once we talk to our stakeholders, once we talk to our evaluation commissioners, we get to know either they will decide and say we want this type of economic evaluation, or we as analysts will recommend one of the economic evaluation methods. So in this slide, I'm just talking into three very relevant and highly these are the more common and more used example of methods that we are using more commonly. There is a number of other economic evaluation methods that I don't have here. In the longer trainings, we do include cost utility analysis and some of the other more complex ones. In the cost effectiveness analysis, this compares one or two programs. If it's a one program, then we compare it to not doing the program. If there's two or three programs, we can compare the programs based on their cost and effects. It's effective when the benefits or the outcome program of the program are similar between options. So cost effectiveness cannot compare, for example, a program that is trying to improve mathematics and a program that is trying to improve reading. So it has to be reading programs. It has to be reading programs in particular grades, for example, between year 1 and year 5 or year 3. We cannot compare a reading program that's trying to improve results for primary students and then another program that is improving it for secondary school. So these cannot be compared using cost effectiveness analysis. In cost effectiveness analysis, an important condition is that your outcomes are similar, apples to apples, oranges to oranges. That's what you compare. This needs quantitative data on costs and outcomes. You need to measure the cost of the program and you may need to measure the outcomes of the program. And it needs some qualitative data to support the assumptions that you make. So we always, as part of the planning, as part of the costing, as part of the developing the model, we make certain assumptions. For example, in the reading program, one of the assumptions that we need to make is that all teachers are willing to be part of the program. All teachers are going to implement the professional learning that they will get. That the school leaders are on board with the program and the schools are ready to do this. The teacher will have sufficient time to attend the professional learning, then be able to prepare for those reading, and then have the time to sort of reflect on whether they're implementing it or not, or some sort of support needs to be there. So for those, we need qualitative interviews, we do focus group discussions, we do observational data. It could be, emergency room visits, or it can be like, classroom observations to see if the teacher is implementing the program in the right way. Cost benefit analysis, again, this sort of compares two programs or one program with its business as usual. It includes all the costs and benefits of a program options. And in the cost effectiveness, we are looking for the lowest cost program, the program that will cost the least amount of resources to implement. So that's the objective. In the cost benefit analysis, the objective of the analysis becomes if the benefits of one program are more than the benefits of another program for the same cost. Or for whatever cost we are thinking, the benefits needs to be, for one program, it needs to be more than that. That's what we are trying to determine there. The good thing about cost benefit analysis is that we can compare apple to oranges. You can compare a reading program in secondary school, and you can compare a program in primary school. You can compare these two programs. You can compare, for example, an immunization program and improving something in the emergency room. You can compare having a justice program and then, spending money on a municipality to do campaign on reducing crime, for example. All sorts of. And why we can do this is because both costs and benefits of the program are monetized. We put a dollar value on both, and dollars to dollars are comparable. So we can compare the benefits per dollar produced in one program to benefits of the program produced in another program. So they can have vastly different outcomes, and we're still able to compare them because we are comparing dollar to dollar, not outcomes to outcome. What that also means is that sometimes particular programs might be less cost, like, their cost benefit ratio might be lower, but they might be more relevant to the context. And that's where sort of cost benefit becomes a bit of a tool that is not very relevant there or very appropriate there. To do cost benefit analysis, again, we need quantitative data on costs and benefits. We also need prices data. So we need an additional element here to be able to put a dollar value on all the benefits that the program is delivering. So there's quite a number of additional pieces of information that sometimes needs modeling. Sometimes you get to sort of look at the national surveys. Most statistic offices conduct prices surveys, and they collect different prices at different periods, and they keep those prices. There's a data with them. They know the prices of various items at different seasons. So those kind of data are very useful for cost benefit analysis. Again, we make assumption as part of modeling, and we need qualitative data to see that our assumptions stand and that we're not assuming something that's not going to be in the program. As I said earlier, very similar to cost effectiveness analysis, that the program there, the unit that is implementing the program, whether that is a hospital, whether that's a school, whether that's an education system, whether that's an urban development system, whether that's a justice system, they are ready to implement the program. They implement the program in the same way. And we need to collect data from different stakeholders to be able to answer those questions. Social return on investment is slightly different in the sense that it is a special case of cost benefit analysis, but there is very innovative ways of calculating broader social benefits of program. So this also compares program option cost and benefits generated as we saw in the cost benefit analysis. We're also looking at social return on investment being higher for a program for a given cost. So we are looking for the similar thing. This is very effective when program planners, budgeting people, decision makers explicitly tell you that they want to capture broader social benefits, the secondary, the tertiary benefits of the program. For example, as I said earlier, in an example, if a road is built and the traveling time through that road has reduced, this will reduce emissions, and the cost of those emissions will not stay in a single unit, for example, in a municipality or a hospital or anywhere, whatever we are thinking about in a municipality. So we need to include all those externalities, and we need to include, for example, when you reduce pollution, people who are suffering from asthma, people who are suffering from respiratory diseases, they might have few incidents of those diseases. So those are the additional social benefits that program brings to society. Those kind of tertiary and secondary benefits will need to be included in the program. If we are, for example, trying to build an education system that produces more productive workers and students that are ready for labor market, that can get higher wages, we will then also look at social benefits of education, because social benefits of education could include reduction in crime rates in the country, because that's one of the effects of education. For example, improvement in volunteer time, people committing to more volunteer time and trying to good to society. So those are the kind of things that will need to be included. This also needs quantitative data on costs and benefits, and it also needs qualitative data, quite significant qualitative data for many of the assumptions and the social benefits that we are including. For example, it is important to measure that the reduction in pollution has caused reduction in asthma and other respiratory disease incidents. We need to collect that additional data to be able to capture those benefits. So this does require quite a substantial amount of data. There is a number of other methods that called value for money, value for investment. All of those methods are also economic methods because they do take into account costs and benefits. Sometimes cost only, sometimes they're only limited to cost analysis. Like, for example, public financial expenditure analysis is also a type of economic evaluation. Even though they are not a full economic evaluation, they still provide an idea for the government whether the money they're spending are spent in the most appropriate way, in the most efficient way, and many other questions that they answer. I've not included them because I wanted to focus on the most used methods here. Now that we know a few things that we have set up, we know our goal, we know our time horizon, we know our perspective, we know all those things, and we have selected one of the economic evaluation method, whichever it is, whether it's cost effectiveness analysis, whether it's cost benefit analysis, or whether it's social return on investment. We need to get actually to work to try to measure the costs and benefits of the program. For that, how do we do that? There is a number of ways for this as well. There is a number of methods. Cost estimation method is one way. There's quite a number of ways. Levin 2018, this method was produced in 1987, and it was updated in 2018. They produced a method called the ingredient method. What this means is that it's a two-step process. In step one, we prepare an inventory of all the inputs in the program. If you're familiar with program logics, we have inputs, we have outputs, then we have all our outcomes, and then we have impact. We really look at all the inputs, and not only inputs that we have budget for, all the additional inputs that enables this program to be implemented. For example, if we are designing a program to be implemented across schools, we might already have classrooms that exist. Teachers might be getting paid from the normal budget of the program. School leaders might be spending time in this program, but they're getting paid from the normal budget of, like, the usual budget of the sort of Department of Education. Doctors in the same way, Ministry of Health are paying salaries, but if you are bringing in a program that will require doctors to spend time on this program, sort of do trainings, change their way, their practice in their practice, their day-to-day practice, for example, the way they talk to the sort of, the way they see patients, the way they record their, observations, the way they prescribe medicine, all of those things could be, additional cost to the program. So we need to look at all inputs, direct and indirect, and we need to take all the outputs, intended and unintended, negative and positive, and including externalities. In the second step, there is a number of methods. There's a wide number of methods that we will include to try to put a dollar value on all the list of cost and inputs that we have, and all of those are costed in that sense. For that, as I said earlier, price data is very important. A lot of central statistical offices collect price data. There could be other things. For example, we do surveys for cost. I'll talk to some of the methods that we put the pricing on the ingredients in a bit. So this is where a number of valuation methods could be undertaken as part of economic evaluation. So when you start looking at these things, you will, when you, as an economic evaluator, when you arrive, the program will give you all the expenditure data. So that is the financial values of the inputs, all the things that has been budgeted, and the program expenditure include all of those. So that's really easy numbers. You will take it and you will review it. You will just adjust it, look at that, and all of that. And some programs, in terms of benefit valuation, will have revenues, will clearly have a revenue stream. For example, a hospital people might be paying fee because you improved the way patients were seen in the emergency room. Now there's a 10% increase in the visit rate. So that is the additional revenue that you will include in the benefit or change in income. Then from here, once we stop this costs are calculated, then there is second other costs that for which real markets exist. What this means is, for example, in every country, wage rate is known. Average wages, that data exists with central statistic offices. Minimum wage exists. Sectoral wages exist, and many different types of wage data exist, and that can be used. For example, if a doctor used to be using 2 hours to do a particular procedure, and the program was able to reduce those 2 hours by 20 minutes, that's a 10% or some sort of, improvement or around 30% improvement or something, then we will use the doctor's wage to calculate the benefit to the program. Or if it increases the work of the doctor by 20 minutes or 10 minutes or 5 minutes, to achieve particular outcomes, or increases the teacher time used to teach reading, or they're doing professional development and they're using some of their teaching time towards that, then we will need to calculate those inputs as well, because those are not going to be in the program budget. Price of goods and services, if there is particular goods offered in the program, in kind support is offered, then we will need to find the prices for those goods and services in the market, and we'll then put those numbers beside those services and calculate the total cost. Some types of cost cannot be measured in the financial markets, cannot be measured in the real markets. For those, we have pretend markets. What do we mean by pretend markets? For example, people are willing to pay, for example, if there is a very good school in a neighborhood, the house prices in that area will go up. That good school has now caused the house values to go up. That is a indirect benefit that the school produced, but how do we capture it? I think there's a number of different ways to capture that. We can go and ask people, how much extra are you willing to be living in this neighborhood for your child to go to this school? Or if we are building a new highway, one of the costs that highway might produce is noise and pollution to the people who are living around it. So that is a cost to those people. Some of these people might go and install new windows to try to insulate themselves from the noise, or people might start to sort of install things that clears the air in their house because they are now living by a highway and there's more pollution. So all of those things, there's no real market for those, and those are measured either through willingness to pay. Stated preferences are when people tell you very clearly, for example, the housing example, that people have shown that they're willing to buy a house for 10% extra price if there is a good school or a good hospital. Revealed preferences is when people, when there's no market to show that, but you tell people that imagine if there is a school that will improve your child's result by this much, or if there's a hospital that will help you with these kind of disease treatment, or if your municipality was able to build roads in this way, what will you be willing to pay for that? Or what will you be willing to pay to avoid particular sort of negative, phenomenons? And those are the kind of things we bring. Value banks have, as a recent phenomenon, people use surveys, especially longitudinal surveys, to calculate cost of particular things and benefits of particular things. And they are ready-made, exist. And if your program is very relevant, you just contact those banks, give them your needs, and they will give you the values, and you can include them in the cost benefit analysis. This is kind of slightly an advanced, for SDGs, for example, there is a value bank now. If you achieve particular goals, they can estimate what is the benefit to the society, to that particular society of achieving that. It's called the International Social Value Bank, and that's accessible. And people can even do training, and they will train you and show you how to do this. All of these three different type of costs, we have a way to estimate them. Then there is intangible costs. These are not, for example, these are not the pollution that people feel, or this is not the extra time that the doctor invests, or the extra time that the teacher invests, or the extra benefit that the students are getting. These are quite different. For example, you are in a beautiful city, you enjoy being in that city. That's an intangible benefit that you enjoy. The happiness that you get from that is a benefit to the society. More happier societies are better societies. City decoration can produce that, or a violent crime sort of injures someone, the pain that they feel and the pain that the family and friends of those people feel is a cost of the crime to that society. We have ways to capture that, as I sort of earlier talked about. For example, connection to a particular culture gives people identity. People really sort of put a pride in that, wear their cultural attire, they eat particular cultural food. And the availability of these services has a value, an economic value, a positive economic value, and the absence of it has a cost to people. So all these cannot be easily quantified in cost, but there are methods, econometric method and statistical methods to calculate all of these costs. For example, the value of a statistical life is one way to look at what is the life, well, like, if in a war people die, what is the cost of that war? And one way to estimate it is this many people died because of that war, but also the economic cost of these people being absent from labor market, the economic cost to the family, the pain and psychological pain that is on the society and on the family could be calculated in the economic evaluation. Slightly more technical, slightly more sort of difficult to calculate cost, but those can be included. Sometimes when we cannot calculate a value for these intangible costs, we can qualitatively say, while the program has this many benefits, there were these intangible costs, but which cannot be valued at a dollar value or benefits in that sense. Now we're getting to the phase where our cost-benefit analysis model has come together. We have produced all of the stages of the cost model have been produced. The benefit has been calculated, and we have a matrix of costs and benefit in front of us, an Excel sheet that shows costs and benefits. Usually cost happens over a number of years. Projects are 2, 3, 4, 5 years. As I said earlier, 20, 10 years implementation time. And benefits are the same. Benefits can accrue. A program that started in 2015 would produce benefit in 2030, 35, 40. Those benefits across these time periods are not the same. $1, for example, in the 2000 is very different to $1 in 2026, because that dollar could buy a lot more than the dollar that we have today. And that's, inflation is one reason for that. In addition to the inflation, we human beings have a preference to have money now than to have it in the future. There is many, many reasons for that. When people are younger, they want to have money to enjoy. So that's one. The other thing is people are not sure about future, the risks that are associated with the future. People take that into account and they would want to have the money now. People prefer consumption now than later. And also people calculate that if they have money now, they can invest it and that investment can bring them benefit in the future. So because of all of these reasons, there is a time preferences for money, and we need to take that into account to be able to compare dollar to dollar. Otherwise, our numbers will be very, very different to each other. So what we do is we use discounting for this. A discounting practice is if the cost happened in the past, we will inflate it to today. If they were to happen in the future, we would deflate it to today. If benefits were to accrue in the future, we will deflate it, and we will also use discount rates to make it the present value of that, present the present value of that. Discount rate, where do you get a discount rate? So it's not easy to easily calculate discount rates. How do we get discount rates? Discount rates, various treasuries produce discount rates, and they will give you some guidance. There is quite a significant discussion in the discount rates. For example, there's risk-free discount rate, which governments calculates. For example, that is the rate of US treasuries. These days, because of the conflict in the Middle East, we usually hear about treasury yields are up and treasury yields are down. And US treasuries and some of the other global treasuries are considered some of the safest investment in the world. So that is the risk-free discount rate. Then there's other type of, for example, credit card has a very different interest rate compared to treasuries, as I said earlier. So those are the costs those are the discount rates, market interest rates that could also be used as discount rates. As I said, these are usually provided by treasuries. For example, in Australia, our National Commonwealth Treasury provides guidance on this. Each state has their own guidance based on the interest rate in that state and based on the investment and all the other things that they consider. For example, right now in the state in Melbourne, in the Victorian state where I live, 4.5% is the Treasury guidance. That is the discount rate we usually use for economic evaluation in this country. Any benefits that happen in the future, we will have to use the discount rate to reduce their amount to present value, and any cost and benefits that have happened in the past, we will then use discount rate or interest rate to increase the amount to the present value. Once that exercise is done, we are getting closer and closer to the final output that we are expecting from our economic evaluation. An important exercise as part of economic evaluation is to look at uncertainty in the future. For example, if I talk about the highway program, highways usually produce benefits 20, 30 years into the future. But future is very uncertain. There is, prices could increase, new technologies can come up. We used to have petrol and diesel cars, and now we have a lot of electric cars. For example, preferences for, the government might actually build another rail line, and that might reduce the burden on the road. And if we calculate the benefit based on today's numbers and into the future and forecast into the future, that brings a lot of uncertainty into the benefits. So we need to be able to look at that uncertainty and test that at what level of changes in benefits, at what level of changes in cost, our results of our model will stand. So that is very important. Sensitivity analysis is the same. For example, the discount rate that we are selecting, as I said, there could be a discount rate, a risk-free discount rate. The Treasury rate could be very low. If we use that, then we might be overestimating the results, the benefits. If we use a much higher interest rate, for example, the market interest rate, that the credit card interest rate, 9, 10, 15, 12%, then we might be underestimating the benefits of the program. So that sensitivity needs to be tested. Inflation is the same. For example, inflation carries both sensitivity and uncertainty. If someone asked me in 2018 and 19 how inflation will look in the next 10 years, my assumption would have been 2 to 3% in Australia or in many other countries. And then came COVID, and then post-COVID recovery, and we saw the world saw a huge inflationary problem, and interest rates were risen. So all those uncertainties will actually change the results that you can produce to your donor, and all that needs to be taken into account. One more thing, we make assumption in modeling. Some assumptions, for example, we assume that the program will benefit a particular region, and as I said, in that region, there might be a big change. The attitude of the people might change. I mean, there might be flying cars that people are now using and not using the highway anymore. There might be drone technologies that could start to deliver certain things and all those. So those assumptions will need to be tested against those kind of things as well, and whether really to figure out if there is one assumption that is driving the results. We wouldn't want that to be the case. We want to be the case that no assumption is as important, that if we change it even slightly, our results will go from positive to negative. If that is the case, then your results are actually very shaky. They're very uncertain, and your sensitivity analysis will not pass. How we do this is, as I said, for example, for the reading program, there were three different types of benefits. They were calculated at 2% interest rate, discount rate at 3.5%. The result I showed you was 3.5%, and at 5%. If those people knew that interest rates will rise again, they might have tested it at 9% and had a very different results. Given the results were all sort of across all four programs, the program that came out the most cost effective will still be the most cost effective, but the size of the benefit and size of the effect will reduce significantly. So that's one way to look at those things. As I said, inflation, for example, if we are spending in the past or in the future, and we see that the inflation will change. For example, if we are doing a pre-program cost benefit analysis, and we think that this program will have expenditure for 10 years, and if we assume that the inflation rate across these 10 years will be 2 to 3%, then we also need to test those costs based on 5% interest rate and say 7 or 8% interest rate to see what changes in the model. As I said, the key thing here is for us to know that there is no single benefit that is driving the program. There is no single cost that is driving the program. If that is the case, we need to explicitly communicate that to the program planner, the program budgeter, and the people who are working on the program, and the audience, the evaluation audience, whether this is the Minister for Finance or if the Minister for Health or Minister for Education, or whether this is a mayor or the ministry that manages the mayors and things like that. So they need to know that our model is based on this big uncertainty, or there's sensitivity to particular changes. This is where we start to see the effects of sort of the final output. So that once we do our sensitivity analysis, that is where we get to reporting. That is the final stage of our economic evaluation. And our economic evaluation is sort of complete, and we produce a cost effectiveness ratio, a cost benefit analysis, cost benefit ratio, or a social return on investment ratio. One of these things is produced. Each of these have specific interpretation. Cost effectiveness analysis tells you the additional cost for a particular benefit. Which program produces the benefits at the lowest cost? So the most efficient program, that is in that sense. And efficiency would be across the board, but the lowest cost program, that is what you get from there. In the CBA, you will see $1, what is the amount of benefits produced by a particular amount of investment? For example, for each dollar or for each $1,000 invested, what is the number of benefit? Is it for $1,000? Does the program produces $1,000 worth of benefits? 1,500, 2,000? What is the benefits? That's really, and that tells you if the ratio is higher than 1 unit sort of per unit, then you're saying that each dollar investment is actually producing more than the dollar invested. Social return on investment also produces a similar ratio to a cost benefit analysis, and allows us to sort of make decision based on which program is the most or the cheapest program for the benefit achieved, or achieves higher benefit for the least amount of dollars. Either way, those are the two sort of interpretation for cost benefit analysis and for social return on investment. For reporting, there's particular things that I haven't included in this presentation because we don't have the time, and I can see that Hakima is already there. I'm sort of running out of time. I have 2 more slides and I will quickly go through this. So to tie all of this up, I wanted to present an example at the end. I will very quickly present this and hand it over to Hakima after that. So school feeding programs are global programs that are implemented by WFP and national governments. They are implemented in low, middle, and high income countries. So school, this addresses hunger, improves in nutrition in various countries. In 2018, they reached 370 million people in 17 countries. So this is the study, a particular study that I have highlighted here. The type of meals that are provided that are either hot lunches, breakfast, snacks, or some are part of the humanitarian programs in different countries. They're usually provided in public schools and provided to the most vulnerable groups. Now, if a program like this comes to you and someone asks you to go do an impact or outcome evaluation, I think some of the things we will be looking at is how does this program reduces hunger? How does it improve nutrition? What is its impact on education? What is its other impact? So this has quite a number of impacts. When this program was evaluated across 14 countries, this program came back consistently effective. It improved education, it improved health among children, it improved social protection among poor and vulnerable groups. It actually helped agriculture economy in some countries. So that was an additional benefit. So this is one program, multiple goals: school attendance improved, enrollment improved, learning and achievement improved, food security and malnutrition, food security improved and malnutrition decreased. This also created a sense of community because parent came and they sort of participated and they sort of distributed the breakfast or the lunches. So that how community came around this, and this became a social safety mechanism because in poorer countries where humanitarian crises were happening, the children were able to eat. So this created a safety mechanism, at least for the most vulnerable. And food production was improved because the programs actually started buying from the local farmers, and that's how this started to improve. An economic evaluation of this program was carried out, a cost benefit analysis. The program cost across these 14 countries over a particular period of time was $11 billion. The benefits that the program produced were $24 billion benefits in health, $156 billion in education, $7 billion in social protection, and $23 billion in agriculture productivity improvement. So pretty significant benefits. And that's how your cost benefit analysis will come together. When an average ratio was calculated, it's $7 to $1. For each $1 invested, $7 in return were produced. But when they looked at the total value across all the 14 countries without taking an average of these countries, the return on investment was, if you invested $1 in this program, $20 worth of benefits in health, education, social protection, and in agriculture productivity were produced. So this is really powerful way to talk to donors about a particular program. And that's the value that economic evaluation brings. And that's where I will stop. Over to you, Akima.
Right. Thank you so
Sorry
much.
for a long-winded discussion and not much engagement because our online platform doesn't allow for a lot of discussion and bringing sort of audience on the journey as well.
Yeah, no problem. Thank you so much, Mr. Mohib, to share us with the question, with the explanations, right? I think we heard a lot of like economic evaluation. We heard about decision making. We heard about like money, profit, right? The planning. So now it's time for us to go into our participants. What are they curious about, right? So if I go through the chat, so we have the first question by Raju Laudari. So the participant asked about among 4 options you shared in the beginning, one option was more effective and the other was more cost effective. So based on the economic analysis, which one is recommended or a combination of the 2 options?
So this is a very, very good question. I'm glad, thank you for asking this question. My advice, and when we do economic evaluation, our advice is that economic evaluation should not be the single tool for decision making. It gives you another data point, another information about program, but to make a decision, you need to take a few things into account. For example, effectiveness is important. Maybe one program is easier to implement. The country has the technology for it. It's easier to train teachers. It's easier to implement. There is cultural sensitivity against one program. For example, people don't want their children to learn on a software. I'm just making an example, So in that case, economic evaluation is there for you. It's informing you. Effectiveness is there, that's informing you. But you will need to understand the cultural context to be able to implement the appropriate program. So economic evaluation is just another information, another insight that helps you make a decision. But to make a decision, I think you need broader information to be able to make a single decision. And that's one reason many times the most effective or the most cost-effective program is not picked because they're not appropriate for the program, for the context, for the cultural context, or for some of these things. So I would say if it was purely based on the economic evaluation, the most cost-effective program will be selected. But usually our recommendation is that they should take more things into account.
Thank you so much for the explanation. Yeah, so we also have the next questions by Habibullah. In the cost-benefit analysis, don't you think monetization is quite subjective and unrealistic? Yeah, of course. How can one give money value to the outputs of any program while its outcome and impact might be so much different, positive or negative, and many things could not be valued in money? I think this is referring to the intangible results, right? Yeah.
Absolutely. And that's really key here. That is the onus or the burden of this question falls on the analyst. How honest they are, how transparent they are, and how consultative they are. So if you're like, in a consultative sense, once you produce your cost and benefits, you need to bring it to your stakeholder and tell them, here is the cost and benefits that I have calculated. Here is my methodology, how I have calculated it. Do you think this is the right way to do it in your country, in your program, in your context? If they say yes, then I think you're one step closer to the decision. You also need to be very honest about things you cannot measure, and this always happens. So you need to bring them qualitatively and tell them, here is I calculated my cost benefits ratio is 1 to 2. For each dollar invested, you produce $2 worth of benefits. But I have one cost that I cannot calculate, and this is the cost. I don't know how big this might be and how this will change the ratio. And here is the 4 or 5 other benefits that I could not measure. And the reason we could not measure is 1, 2, 3, 4, 5, whatever the reasons are, and you put them in front of them. And then allow the program decision makers to make their decision based on the information you provide. I think that is the best way to approach it rather than trying very hard to calculate and estimate everything that is not easy to estimate. So in that sense, I think it's important transparency, accountability, being upfront, being consultative, being participatory will allow you to then build a proper model and allow the decision makers to take other things into account.
Yeah, I do agree. I think one of the principle in SRI as well, transparent, verify, and also involve the stakeholders as well, right? Technically. So thank you so much, Mr. Mohit, for the explanation. We can take like I think 2 more questions. So the next question I have here, uh, by Buban. Thank you, Mohit, for this excellent presentation. Just one query on handling economic evaluation. Does it require some specialized human resource in the evaluation team? I think this is referring to the technical part. Yeah.
Look, it does require some specialist skills. For example, I mean, outcome evaluation requires some statistician to come in and do your modeling, your analysis and tell you whether your program is effective or not. Even if you're doing qualitative evaluation, you need someone to be able to properly do inductive or deductive or grounded theory, thematic analysis, things like that for you. So technical skills across evaluation are required, and economic evaluation is no different. Yes, there are particular skills, for example, understanding discount rates, the various types of them, understanding sensitivity analysis, understanding which economic method is appropriate, using those stated preferences and, revealed preferences, willingness to pay. Surveys are a particular way of survey design. They're designed in a way that you extract or get those information from the respondents in a way that actually are credible. You can't just ask questions and get the numbers and then put it together. So there's certain techniques to it, of course. But that said, it's not a black box exercise. It can be learned. We had the 10 step that we showed here. There is many examples online. You can go read a few of them and you get a good idea. You also don't have to do the entire process. The cost analysis in itself will be very informative in certain cases. For example, we went and we did an economic evaluation of the program. The benefits were very difficult to monetize. We only provided them with the cost analysis. And we said, okay, when you started this program, 50% of your budget was going to set up and admin cost. But by year 4, you had reduced that to 20%. So that is a huge improvement, reallocation of resources from admin and setup costs to actually delivering services to participants. That is an information that decision maker can actually be proud of and be, really make their decision making easy. So I think it's really, getting started, seeing where you get stuck, trying to find some help. But it does have a technical sort of side to it, and maybe slightly more technical than some of the other types of evaluation. But there is experts, you can reach out to the experts and then bring them in, even if they're not doing the whole thing in a part, and they can do that for you, and then you can finish it yourself. Writing it and interpreting it, like, is not as difficult as, first you would think. So I think it's getting started is important.
Yep. Yeah, I do agree. Thank you so much for that. So the next question, we still have time, so worry not. I can see there are more few questions. Is it okay, Mr. Mohib, for that? Yeah. So the next question by Solomon, I guess the question about sustainability comes to mind. Yeah, we're talking about ESG, SDG a lot, right? So in the event that donors are no longer in the picture, would behavior change count, or how will you measure a behavior change in economic evaluation?
Okay, economic evaluation is about resource use, and we saw when US aid closed, was abolished, countries that were reliant on US aid for many programs experienced significant difficulties. So that's when you take the donors out of the picture. I think you are talking about reducing available dollars in the sector, if that is a donor. Even if a country, for example, experiences difficulty in paying for health in their country and decides to, for example, privatize a part of the health sector, hospitals, for example, all the hospitals. So you are talking about reducing resources in that sector. Of course, this this changes the economic evaluation or the economic calculation behind the programs by a huge way. For example, in the privatization of the hospital example, the out-of-pocket money that people are paying for health will increase, will go through the roof, because these services are no more funded by government. In the example where US aid sort of, child labor, for example, in a humanitarian context would increase, these negative coping mechanisms that people will adopt to try to replace the aid income that they were getting through the aid will need to happen. They start borrowing, they start eating less, they start child labor, they start, many other, there's quite significant negative impact from those that flow through. So absolutely, when these financial changes happen, the calculation of the economic models will be very different. And I think from that's where the perspective is very important. For example, in the hospital example, the cost of the program health delivery of health might stay the same, but who is paying now? Previously, the government was paying through taxes and through revenue, through whatever sources of income they had. Now, people are paying out of pocket. The biggest burden of paying for health will fall on the poor because the largest proportion of their budget will then go to health services. If they might stop receiving health services. They might sort of stop going to the doctor for particular diseases, and those diseases might then produce, contagious diseases could produce broader social negative impact on others. They could start to have communicable diseases in the community, and this is a real thing that is happening in the least developed countries. For example, tuberculosis. If you don't have free services to treat tuberculosis, and its cases and its incidence increase, this is not only a problem for that country. People traveling from that country to other country could create global and social costs for the whole world. So these are, yes, absolutely. When funding changes, when funding is disappears or funding is reduced, or the way things are funded changes from government to private or from private to government, all of those changes happen, and you will need to rerun your model to be able to identify where changes and how the impact and how the effects of the program changed due to those funding changes.
Yeah, right. Thank you so much for that sharing. So we get to the last question before we go to the next agenda. So I think the last question, they're asking about is it possible to recommend a reliable and valuable online source in this field? I think referring to the economic evaluation because there are three tools that you share, right? So is there any platform or things that they can actually refer to? Yeah.
Unfortunately, I haven't seen an online training. There are university programs that teach cost benefit analysis. There is one website. What I will do is I will quickly find it and put it in the chat. Um, I might stop sharing my screen as well while I'm
Yeah.
doing that.
Let me,
I
yeah.
think you are sharing your screen.
Yeah, I can stop sharing. Yeah.
Yes, please. That will be good. I will share a cost benefit analysis society in the US. They do quite a lot of work in this area and an absolutely amazing work. Slightly technical. The way we talked about this was quite simplified for non-technical audience. but they are very technical. I posted that in the chat, so people are more than welcome to save that and look at that. They have quite a lot of literature. They have recommended books and things. So they can look at that. But unfortunately, an online course, self-paced online course, I haven't seen any. Universities provide courses and things. We do run training. We do 1 day training, 4 day trainings in various parts. We are planning to do some in the next few months across a few countries. So, that's another way. We do it online as well. We do it offline in country as well. We do 1 day training, 4 day training, and we do longer training with teams, 4 weeks and 5 weeks training. We bring a few other things to it, and we do work examples and things as well. So that's another option, but that comes with some cost involved.
Yep. Thank you so much for sharing that. And I also know that some organizations like Social Value International, they are also empowering about SRI, the social return on investment. So later we can also share the link in the chat so that any interested participant that would like to check them on, so just go ahead basically. All right, so let me share my screen again. But everyone okay? Are you guys still with us? I know this has been like 2 hours, right? Can I see some reactions? Maybe like thumbs up or any reaction, or can on your video. Okay. All right. Okay. So thank you so much for the Q&A session. I know that we have more questions that on the chat, but I think that's the only question that we can actually address today because of the limited time as well. So before we proceed to the end, right, let's have everyone to turn on your video if possible so that we can celebrate the session today and then have a group picture. So I will stop sharing, and Ahmad, if you are ready
Yes.
to take the pictures. Yeah. Everyone, if
Yeah,
you're
please.
comfortable to actually on your video. Yeah. And have a very good, like, big smile, everyone. We're excited, right? New knowledge today. Okay.
Okay,
Ahmad,
we have
can
three pages, and this is page 1 and page 2. This open the camera, and page 3. Thank you, everyone.
Thank you, everyone. But don't leave yet, okay? We still have more slides coming on. Please, hope you guys are bear with us, okay? I'm trying to go as fast as I can. So now I would like to invite Mr. Pratik as also a co-leader of Evaluate Asia and India to provide us with the closing remarks. So over to you, Mr. Pratik. Yeah.
Thank you, Hakima. Good morning, good afternoon, good evening, everyone. As we wrap up this 16th capacity building training session, I want to say a huge thank you to APIA, Asia Pacific Evaluation Association, also Evaluate Asia, and all the other partner chapters for putting this together. At this particular moment, this is really an important session that we have bring together, and also to all the participants for bringing so much energy for the session and at the table. I'll be honest with you, from the right, I was also in the journey of learning economic evaluation alongside all of you. It can feel overwhelming at the start because I also felt the same. But today's session, and I think Mohib's expertise that he showed really highlighted how crucial the real this mindset is for the real decision making. And as evaluators, as young and emerging evaluators, we don't just ask for how the program work, but also want to understand and help everyone figure out uh, what is the best use of the resources, the limited resources that we have. He touched upon different topics, I think cost effective analysis, cost benefit analysis, social return on investment. But I think this is uh, this is the starting point. Probably we can learn more by Googling it out or by searching it. And the real magic happens from when we take these findings and translate this into our better programs and stronger programs. And it takes us from being people who just report on the past, from the data that we have, to share to the meaningful and impactful future. Thank you all, everyone, from Mohit, from Hakima, from everyone. I think everyone who was there, organizing committee, Randika, Ahmed, or Yatin, or Kasoon, or Jigme, or all the team members, and have a wonderful rest of the day. Thank you.
Thank you so much, Pratik, for the closing remarks given. So yeah, and everyone, yes, it's part of the APIA, part of the effort today. We also have a few more announcements to be shared. But in the meantime, if you haven't filled in the survey, please click on the link on the chat or scan the QR code here. And then while listening to me announcing, like more webinar upcoming, you guys can actually complete the feedback. Okay. All right. So we have an upcoming webinar on 3rd June on advancing the Tokyo Call for Action for Strong National Evaluation System. So please join us, and we also will be sharing the registration link in the email soon, later. Okay. And the next one, we will have a maintaining evaluations relevant in the turbulent future, repairing relationships, organization, and communities in 23rd June. So yeah, there are 2 upcoming webinars. We hope to actually see you there. Don't forget to also register. And we have a good news. We would like to announce that APIA and Eval community are collaborating to advance AI in evaluations, and there are exclusive 25% discount for APIA members. So if you are not sure whether you are APIA members or not, you can reach out to the committee and then check it out. And don't miss this chance to get to attend the certificate course in AI in MNE. All right. And the last one, we are calling everyone to highlight a call to action, Tokyo Call for Action for the institutionalization of evaluation. So there are QR code here. You can register and scan. We will also be sharing this in the email soon. All right. So thank you, everyone. Again, I would like to express our sincere appreciation to our speaker, Mr. Mohit Iqbal, for very, I would say, insightful explanation on the academic evaluation, for sharing your knowledge and also experience with us. Thank you very much to all participants to keep, I would say, committed in this session for more than 2 hours. To the organization, to the organizer committee, and also we hope this session has provided useful insights and strengthened your understanding on the topic. So on behalf of the organizer, thank you once again for joining us today, and we are very sorry for all the inconvenience causes. And have a wonderful day ahead, and we look forward to seeing you on the 3rd June, I hope. Thank you and goodbye, everyone.